morning, students. I am Shipra Banerjee, Associate Professor of Brainware University, who want to deliver a topic on poison and antidotes. First of all, we should know what is poison. So, poison may be defined as any substance administered in whatever way by mouth or injection or inhalation, skin or mucous membrane produces ill health, disease, or death. That means poison can be inhaled or injected, can be ingested by mouth or the mucous membrane or the skin, can be done by the suicidal attempt, can be done by the murder attempt. So this type of antidotes or poison can produce ill health and disease or death. Maximum cases death is the main objective. So diagnosis of poisoning is often difficult, but acute poisoning may be accidental, occupational, suicidal, or criminal. That means poisoning reason is different. So some medication is also there, which are the major cause of drug poisoning. Some of the person get poisoned through the drug ingestion day by day. So the poisoning, either accidental or intentional, requires immediate support and symptomatic management to avoid any threat to life. That means if any person accidentally or intentionally requires engulfs any poison, they require immediate support and systematic management to overcome or prevent the threat to life. The perfect management and treatment solely depends upon the identification of ingested poison, that is a corrosive substance, so that specific antidote which can counteract the poison can be used. That means some of the antidotes or some of the neutralizing agents should be used that can counteract the poison, that can destroy the poison. Now coming to the classification of poisoning. The poisoning can be classified into three categories: intentional poisoning, unintentional poisoning, and undetermined. So person taking or giving a substance with intention or causing harm to that person, like suicide or assault or to murder, so that is the intentional. Unintentional means the person taking or giving substance without knowing its toxic effect, that is accidentally, or some of the medicine is kept there, that may be poison. The patient thinks that it is a medicine, he takes it, or some of the person is giving to murder the person, but he knows that it is not the poison, it's medicine, so it is unintentional. That is not, patient is not taking intentionally, but some of the person is giving to, that's why that is unintentional. Undetermined, when the distinction between the intentional and unintentional is not clear, that is the patient is unconscious, then process is known as undetermined. Like pesticide or insecticide, this is used in the crop fields or the agricultural fields, so day by day this can introduce in our body and cause poisoning. Now other causes. So most common causes of poisoning is heavy metals, which occur by metallic contamination of food or water by bleaching process. So in case of food or any water that is coming throughout the water system from the municipality, so the lead containing pipe system which leaches poison heavy metals day by day. And there are some another cases like overdose of drug inhalation. So intentionally cyanide poisoning is one of the causes, that is also important current. Now, how can you understand the patient has engulfed poison? Suppose you are not in a home, some of the person has taken poison, so that way he is having reduced breathing rate, nausea, vomiting, diarrhea. The patient is not answering properly. So, but you can understand these are the symptoms: increase or decrease heart rate, and dilated or shrunken pupil may be dilated or shrunken, muscle cramps will be there, and partial consciousness will be there. So these are the symptoms of poisoning. Now heavy metal poisoning. Depending upon the content and type of heavy metal, toxic effect can be seen in the future. Suppose some of the person is working in the mercury or in the lead company, so there will be toxic effects after a long time, after a period of time. So treatment. So in case of intentional or unintentional, whatever the problem is there, activated charcoal is given initially for absorbing heavy metals or poisons. That is an important cause. Next, then the emetics are given to eliminate any poison left in the stomach, which will eradicate all the poisons. Some inorganic compounds like heavy metals and prevent their absorption in the blood circulation. Activated charcoal, light kaolin, copper sulfate, magnesium sulfate, these are the important substances. Cyanide poisoning may occur by inhalation of fumes of hydrocyanic acid, ingestion of inorganic cyanide salt, cyanide releasing substance like cyanamide, cyanogen, chloride, pitch of apricot, bitter almond, and photogrammic chemical and silver folices. So consumption of 300 milligram of potassium cyanide may cause death. Okay, so small amount of cyanide poisoning also causes different poisons in this is different मतलब क्या adverse effects to our body. So physiology of cyanide poisoning. How the cyanide poisoning going on? So cyanide readily combines with the ferric ion of the cytochrome oxidase, which prevents the electron transfer, stops the cellular respiration and oxidation reduction reaction. That means in the hemoglobin or in the cytochrome oxidase, that is one of the electron transport chain present in the mitochondria, where it will combine with the ferric ion, and as a result electron transfer will be prevented and cellular respiration will be prevented. Now coming to the treatment, sodium nitrite and sodium thiosulfate injection, both the antidote one by one are administered for the treatment of cyanide poisoning. So antidote. Antidote are the substance which react specifically with the ingested poison or toxic substance. They are used to neutralize the effect of poison in the body. Now coming to the classification, according to their mechanism of action, they are classified as physiological antidotes and chemical antidotes. So physiological means they are also called antagonist. They produce the effect opposite to that of the poison. That means antagonism is there. So they are used after some of the poison is absorbed in, like in physostigmine, that is a natural drug like from datura, or this is the very poisonous drug. So physostigmine can be used as an antidotes also, some of the natural drugs. Okay, next, chemical antidotes. So they react by combining with the poison and changes its chemical nature by converting the poison into the inactive or harmless compound. That means they will convert the poison into harmless compound, like sodium thiosulfate, which convert systemic cyanide into non-toxic thiocyanide. EDTA, that is a chelating agent for heavy metal poisoning. Now there are some another antidotes like the mechanical antidotes. They act by preventing the absorption of poison into the body or expelled out the poison by emesis or eliminate through the urine or activated charcoal. So they act by preventing or absorption of the poison into the body or expel out the poison. Now copper sulfate. So magnesium sulfate and sodium monohydrogen phosphate Na2HPO4 inactivate the poison prior to absorption. That means if the drug is given instantly, so they will absorb the poison and precipitate the toxic material as soluble salt. Now antidotes for selected unabsorbed inorganic poison and drug overdose. So make a list: poison or drug overdose. So antidotes and mechanism. Suppose acid, some of the person has taken the corrosive acid, then what can I give? Then we cannot give the base directly because base is also very corrosive. So antacid or weak acid or alkali, that is very weak in nature, milk of magnesia, these will use as the antidote. Or this time you should avoid the vomiting, because some a person has taken the acid and that is going throughout his esophagus and to the stomach, but if you vomit there will be again very problematic to the patients. So mechanism here: chemical antagonism and base neutralization. Now alkali, some of the person has taken the caustic soda like this, so then you should use the weak acid like lemon juice or diluted vinegar. Acetic acid can be used for the alkali antagonism. Here is the mechanism: chemical antagonism in going on, acid base neutralization. Now coming to the iron salt, that is a desferroxamine sodium carbonate. This type of iron salts can be used for the antidote as the iron poison. So here chelation works. Then copper and lead salt, that penicillamine, that is the antidote. So here also chelation is the mechanism. Mercury salt, this is very important poisoning. So dimercarpal, that is the BAL, that is also known as a British anti-Lewis, that is used for the poisoning of the mercury salt. The drug is also worked by chelation. Now sodium nitrate injection. NaNO2. Remember, sodium nitrite is NaNO2 and sodium nitrate NaNO3. So here comes the molecular weight and the synonym: nitrous acid sodium or HE nitrate. standard. It contains not less than 97% and not more than 101% sodium nitrate. And the methods of preparation, how can you prepare it? It is prepared by strongly heating sodium nitrate. So NaNO3 is heated, as it is an NaNO2, and oxygen is liberated. It can also be prepared by heating nitrate, the lead, NaNO3 plus Pb. So as a result, NaNO2 and PbO will be prepared. So this NaNO2 will be used for the antipoisoning drug. Chemical properties, physical properties you should study. It is yellow or white crystalline powder. It has saline taste and freely soluble in water but less soluble in alcohol, and it is odorless in nature because it is a chemical compound. And when it is exposed to air, it readily forms sodium nitrate. Now coming to the uses, nitrate ion releases the smooth muscle of the blood vessel and give the vasodilator action. That means this drug is also used as a cardiovascular drug also. It is mainly used in the cyanide poisoning, mainly. It was also used in the anti-rust solution to prevent the rusting of the surgical instrument. That means whatever the instruments are used for the surgery can be rusted. That's why it is used as an anti-rust solution. Now mechanism, how it works. In cyanide poisoning, the injection of sodium nitrate is given primarily, which causes the oxidation of the ferrous sulfate Fe2 of hemoglobin to ferric ion of the methemoglobin. That means the hemoglobin containing the Fe2, which will be converted to Fe3 of the methemoglobin. It will be converted to methemoglobin. So this methemoglobin then combines with the serum cyanide and produce cyanomethemoglobin and protect the enzyme from the harmful cyanide. So how this drug is working? The drug actually combines with the methemoglobin and combines with the serum cyanide, whatever the serum has been taken or engulfed into our body, and thus produce cyanomethemoglobin. That means the drug will be combining with the cyanomethemoglobin and protect the enzyme from the harmful enzyme. Which enzyme? Which I have written is the ferric oxidase. So you can take the purity test, that is the assay. The simple sample is tested for the percents of heavy metals, not more than 0.002%, and loss on drying, not more than 2.25%. So incompatibility, it's incompatible with the acetinolide, ethylpyrine, phenazone, and caffeine, citrate, chlorate, and hypophosphate iodide, mercury salt. So these are the infusion tinctures are the incompatibilities. That means it cannot work with this type of substance. So doses of injection, 10 to 15 ml of 3% injection IV is the doses. Now coming to the sodium thiosulfate, that is a molecular formula Na2S2O3 248.18 gram is the molecular weight. Synonym means sodium hyposulfite or antichlor. It contains not less than 99% and not more than 101% of Na2S2O3. Next, how prepared? It can also be prepared by the boiling sodium sulfite to sulfur, that is Na2S2O3. Next, it can also be prepared by the passing SO2 gas in a mixture of sodium sulfite and sodium carbonate. See, Na2S, Na2CO3 plus 4 SO2. So it converted to Na2S2O3 CO2. Next, sodium thiosulfite is also prepared by reacting the sodium hydroxide with sulfur. Na2, NaOH plus 4S equals to Na2S2O3. So from here it can also be prepared. Now physical properties, it occurs as large, prismatic, crystal and transparent, effervesces in air. It is practically soluble in water and insoluble in alcohol. It starts melting at 50 degree and 100 degrees centigrade, loses its all molecules, and the chemical properties come in. The aqueous solution demonstrates molecularly as that the aqueous solution decomposes slowly in air. That is, Na2S3 will be converted to Na2SO4, Na2S2O5 and Na2S. Okay. Next, barium chloride also reacts with the sodium thiosulfate, sodium to barium nitrate. By this process we can chemically identify also. Mechanism. So after 5 minutes of injection of sodium nitrate, a slowly IV infusion of sodium thiosulfate is given. That means after 5 minutes of sodium nitrate injection, sodium thiosulfate is given, which causes dissociation of cyanomethemoglobin, which can remove the cyanomethemoglobin and set free cyanide ion. And cyanide ion is not, whenever is along with the cyanide sulfur, it is not having any toxicity. By sodium thiocyanate. Next, Next, the cyanide ion CN is converted to an thiocyanate ion and by sodium thiosulfate in the presence of enzyme glucanase and by isocyanate on then extracted from the body or kidney. Now coming to the uses, it is used as an antioxidant. It is limited to solution containing antidotes. It is useful as standard community and then physically or topically it can be used as antifungal agent. It is also effective antidote in the late bismuth, mercury and iodine poisoning. It is also used as the after-exing mini photographic work. The textile industry it is Next, the textile industry is also uses the anti-chloro bleaching process. Now come to the last, that is the doses. Then IQE recommends a dose of injection which is equivalent to 0.3210 gram, so administered by IV route. So there are some activated charcoals which are very readily to use and it can be used, which can be heated up to 500 to temperature 9000 degree. Okay, next we can use the properties of the activated charcoal. We should start it is very easy. Black, colorless, tasteless powder. It is free of gritty matter, insoluble in introvert organic solvents are soluble in it. And like this way, you have to study all the antidotes. Thank you all.